Okay, guys, I brought you back to the main room just so that we can have a quick wrap up, and I am recording this little part. So the main focus for today was just to give you a bit of a taster about what we're going to be looking at in the next 4 or 5 weeks. So the take-home message is, yes, it's quite tricky to tell a blast cell from other cells, particularly lymphoblasts from reactive lymphocytes. But the clue is looking at the size of the cells. So blast cells are very, very big. So lymphoblasts are usually 2 to 3 times the size of a normal red cell. Myeloblasts are up to 4 times the size of a normal red cell. Myeloblasts are usually quite heterogeneous in their shape, and usually their nucleoli are easier to see. Lymphoblasts tend to be more homogeneous in their shape, although just as you can in a normal blood film, you can get small lymphoblasts and large lymphoblasts. The majority of the ones that you see are small lymphoblasts. Depending on the sort of precursor leukemia you have, so these are the acute leukemias, it can be very difficult to tell myeloblasts from lymphoblasts. And I mean, you'll get a bonus mark if you can tell me that, but if you can just say there are blast cells here, then that's what I'm really looking for. Again, learning the populations most at risk of precursor neoplasms, hematological neoplasms, is going to be of great benefit to you. So one of our cases today, so the case of ALL that we had today was unfortunately a little 3-year-old, so a 3-year-old female. And so it's knowing the sorts of health conditions that are more common in young children that will help you decide whether or not you've got a leukemia and what sort of leukemia that it is. With the mature leukemias, so the chronic lymphocytic leukemia and the chronic myeloid leukemia, usually CLL, you just get lots and lots of what look to be normalish looking small lymphocytes, whereas with CML, that's when you tend to get your range of precursor cells there. The majority of them are usually neutrophils or band forms, but you can get metamyelocytes, myelocytes, and down to promyelocytes. Occasionally you'll see a blast, but really not many of them. So with our precursor leukemias, our blast, our acute leukemias, you get a lot of blasts usually. Certainly the ones that we'll be showing you have a lot of blasts in the peripheral blood. And so you don't really see that many other mature cells. If you see mature neutrophils, then it might be that you've got an acute myeloid leukemia. If you see mature lymphocytes, it could be showing you that you've got an acute lymphoblastic leukemia. But it's really these days, it is enough for you to be able to recognize that there are blasts present, or that there's an abnormality present in the first place, and whether or not there are blasts present. And then you would go on and do the differentiation, so the immunophenotyping, cytogenetics, and the other molecular studies looking for the specific mutations, molecular mutations. So just before we leave, make sure that you have a look at the questions on flow cytometry, and that you understand how to recognise when cells are positive for a cell marker and when they're negative in the scatter plots there, or dot plots they're also called. So make sure that you can work your way around those. Put some questions on the week 8 discussion board if you've got any questions there, because we really didn't get round to having a look at those this week. But we will be having a look at flow cytometry, probably more so when we look at the acute leukemias. Next week we're looking at the mature myeloid neoplasms and also the dysplastic syndrome. So we don't use phenotyping that much there with them. Usually we use cytogenetics and molecular studies more there. So don't be concerned. We will be revisiting all of these films again, and we will be revisiting all of these neoplasms again. Okay, so today was very much an introduction into what you're going to be looking at over the next few weeks. So if you've got any questions, please put them up on the week 8 discussion board, and I'll see you in the web room on Monday for our next lecture. Thank you very much for your attendance today. Has anybody got any quick questions before we leave? Nope. Okay. Thank you, everybody. Thank you for your attendance. And yeah, and I'll see you next week.